was my grandmother, who came out here in the 50s, my mom's mother, and she started a real estate practice. And you all will know that during that time, there were all the redlining, and Black people could not buy property. So my grandmother and her partner, they would sell houses, save commissions, and then they would use that money to loan to Black families so that they could purchase homes. And still today, around the Haight, the real estate company still survives. My sister and I bought it back in the 90s, and my sister still runs it. People will still come into the office and say, hey, your grandmother made it possible for my grandmother or my extended family to be able to buy a house. And some of them still own that property. So that's pretty fantastic. What we all think happened in the 70s when redevelopment came around, we don't call it redevelopment, we call it relocation, but it totally destroyed the Fillmore. And that's where you had, the music and the food and the clubs, and that's where Black people hung out. And also that's where, we had community there, and we had community in our churches, and we had community at school. But when the redevelopment agency came along in the 70s and just destroyed the neighborhood, kicked everybody out of the houses in the hopes of, I don't know if it was their hope, but the idea was that everybody would be able to come back in when they rebuilt it. But that never really happened, so much so that in 2001, when there was more housing being built for first-time home buyers, the idea was that people who had been pushed out all those years ago would be able to come back. Well, of course, you can imagine 30 years later, trying to find those folks and get them to come back is very difficult. But that all led to the fewer and fewer people of color, Black people in particular, who are living in San Francisco, not to mention how expensive it is. So I think that one way that we have totally lost community is by having people move, to all parts of the Bay Area. And it's just a different time that we live in now. When I grew up, my parents did not have to give me the talk about police officers or what you do when you get stopped, because that wasn't really happening, and because we knew our police officers and they knew us. But I have a son and a daughter, and when my son was 19, he was stopped. We had obviously already had the conversation with him, but I think it just builds this resentment and anger among us. There's just a loss of trust and this feeling that we're not really wanted here. And again, because it is so expensive. So it was really great when Brett thought about, when he started talking about this idea that, we really need to come back together and build what community we have left. And it's not that he was the first one to have this conversation, because I feel like we've all been thinking about it for a long time, but he really put it together, which I think is really important. And just this idea being that there is a way for us we can come together and start talking about what we need, how we need it, and how we're going to do it. And then hopefully get the support of our allies to help us build on this coalition. So I would just say that growing up in San Francisco has been fantastic, but it's really hard now because it's a hard place to live. And it's this, if you have, you used to be able to walk down the street in the Fillmore in particular, and you would see people who look like you. But now it's, I can walk around all day in San Francisco and never see somebody who looks like me. And that's a hard, that's hard. If you've never experienced it, it's really hard. So I'm super grateful that I have a big family, and we all, we share a lot, and I get to see them a lot, and those are my, support systems. But I would say what we're doing with with this council is really try to rebuild not what we once had, but to make it better for all of us and really to reconnect with the sense of community. That's it.
Thank you so much, Kelly.
Thank
Thanks
you.
for sharing your personal story and that history. It's really important to know, and takes courage to say. So thank you. I'd like to pass the virtual microphone to Brett Andrews, who will focus his initial remarks on present day challenges as well as accomplishments as they relate to racial equity issues in the city and beyond. Brett.
Remember, under this space, we're talking about legal versus lived equality. Legal often means laws, policies, regulations, those things that are in place that often are designed, developed, and ultimately implemented what we think of as upstream. As those flow down, those go to the beneficiaries, the recipients, the consumers, the clients of those policies, and that's what we think of as downstream. And what we're seeking to do is to make sure that there's a deeper, more consistent thread and connection between what gets talked about, designed, developed, and ultimately deployed and implemented with meeting the actual needs of the community and the beneficiaries. And that's hard because often those are just two different populations of individuals that don't necessarily talk to each other. And nor is this population, by the way, often invited into this discussion. So it's very clinical and very much ethereal and theoretic. So as I think about certainly health policy, it's interesting where Kelly starts her story in the 50s and 60s. What we saw, I'll give 3 examples of health policy that have to do with mental health, HIV, and now COVID. And you'll find this as a common theme throughout these 3 examples. You know, in the mid 20th century, there was a big deinstitutionalization of our state hospitals. There was the realignment and pushing the responsibility and the associated costs to the community. That did happen in an extraordinary way. I'm proud to say in San Francisco, that wasn't always the same for the jurisdictions across California and certainly the nation. But what was very clear was while community-based mental health services in the mid 20th century were being designed, they were being designed under what we call, and I'm looking at Scott Arai and I see John Postel, under these ways in which there are standards of care. A group of people came together who are the intelligentsia and decided there's a standard of primary care of mental health and behavioral health care. And I would argue then and even now, those standards of care often don't take into account the cultural, ethnic, and racial nuances and considerations that should be there. So for example, African Americans are 2 to 3 times more likely to be misdiagnosed with a more severe diagnosis of schizophrenia than the general population, and 10 times more than their white counterpart. And that is because many of the service providers don't have a full understanding of that population of individuals. Now that's difficult because that's exactly what we're seeing, unfortunately, in our homeless population. A misdiagnosis, often with a misdiagnosis comes a misdiagnosis or a prognosis of how to solve for that, which are just inappropriate meds for what ultimately the person is experiencing. So as I think about, again, health policy, we're seeking to take health policy, inform it in ways in which we take the conditions on the ground, bring them into the conversation, and widen that view so that it is a greater consideration for the population that we seek to serve. As I think and move forward into the latter part of the 20th century, I'm thinking about the AIDS epidemic. Many of us have experienced that in some form or fashion, family or friends, that was very close and ravishing to our community. In the 80s and into the 90s, what was often called the gay man's disease, you know, what was often the understood you in that was it was the white gay man's disease. And so what do we do from the mid 80s all the way up into mid 90s? research and development. Everybody was racing to figure out a way, if there was a way to find a cure, a vaccine, some antiretroviral that could help in order to stave off the death and the destruction that the epidemic was presenting to the community. And indeed, in the mid-90s, it happened. We got antiretrovirals. Now, here's where COVID and HIV are the same. Now you have the antiretroviral, you have the vaccine, you have what is needed, and now you have to have a distribution system and a framework and an infrastructure and a mechanism for distribution. And unfortunately, for many people of color and their communities, those mechanisms weren't in place. For those who are urban planners or urban planner enthusiasts or real estate investors, you all know that there's a formula for a per capita and a geographic area, how many clinics and hospitals should be there, how many grocery stores should be there to serve the population. And unfortunately, what we saw in the HIV community is that it was there and the structures were there for a lot of our Caucasian white gay males in order to access that. And indeed, there was not that infrastructure in place in people of color communities, specifically our African-American communities. Jimmy and I have had conversation about this, and we sit on the subcommittee of health. And one of the things that I will argue, and I understand that it could be slightly provocative, is that there was a missed opportunity for what is often a revered institution in the Black community, that is our churches, who could have partnered with our local clinics and our hospitals to expand their programming to make sure that they become the mechanism, the vehicle, and the infrastructure that educate our people and to get those meds into people's hands, and ultimately more people would have lived. There are many other things that were contributing factors to that, and we still are grappling with that every day. Jimmy headed the AIDS office here at DPH for many, many, many years, ran an AIDS service organization in LA, understands it deeply. So it's nuanced, but I just, again, go back to culture, community, and infrastructure, and what we need to do to build it so that people can access resources, information, and the necessary services that they need. Fast forward to today, COVID. I'm sure that story that I just said has a striking similarity to some of the things that we're facing. That in many ways, we have more people, unfortunately, people of color infected per capita, more people dying per capita, and less people getting the vaccine for a myriad of reasons that have to do with, again, lack of infrastructure that is there in order to get people to the vaccine, the history of African Americans and the challenge that we've had with the healthcare system. And I'm thinking of the Tuskegee Airmen who unfortunately were infected with syphilis and were basically their own, which is heartbreaking to me, which is their own experiment and test that government did on them without them even knowing. And so it's hard to trust a government when a government was willing to see you no differently than a monkey or a rat or any other experimental animal. So there's lots of education and a lot of things that need to be done to build trust. I see my thing is dinging and I'm getting ready to wrap it up. So I'll just say that while we continue this conversation, and I was glad that we sent out a clarion call to our leaders across the community to come together and address these issues, resistant, historic issues of racial disparity, economic disparity, social disparity, political disparity, and see if we could create some needle moving work, long lasting and positive. And thus was the birth of the Black Leadership Council. And Chris is going to share a little bit more about what we have charged ourselves with and what we are inviting you to support us in that effort. So again, thank you everybody for joining. And I'm looking forward to continued conversation tonight and beyond.
Great. Thanks so much, Brett. I really appreciate everyone joining tonight. I won't repeat what I said earlier, but what I'll open with is a short story of how I met Brett. When I first met Brett, he was hiring for this position. It was the first of its kind for PRC. And at the time I had heard of some of the work, but I didn't associate the name PRC with some of the work that the organization had done. And so when I heard the vision from Brett over Zoom, because this is during the first quarter of the pandemic and everything was over Zoom, and it was kind of interesting onboarding experience to come on board for such a new big role for the organization, who had spent 50+ years doing the management and the treatment of clients during the HIV/AIDS crisis, during people's challenges with mental health and behavioral health issues over these years. Hearing him and reading about the great work that he had done prior to me meeting him, hearing him talk about something slightly different, because I frankly am not an expert in some of those things that PRC has done over the years. What I heard from him was a vision about, while I love doing this work and I love being able to talk about the impact of being able to help people get back on the road to recovery and to health, I really wish someone can help us figure out who's throwing these bodies into the stream, the proverbial stream, where we're having to catch them down here to treat them, to manage poverty, to manage sickness. How do we help try to get at some of those upstream root causes that we heard a little bit about earlier in the presentation, and that we've heard, I think, ad nauseum many times in the recent year or two, which I think is a good thing, around how do we get here? How do we actually start to think differently about the root causes of poverty, of sickness, and why do we need a PRC? I think it's great work that we're obviously doing, but if we were actually doing this correctly as a society and as an economy and as a government and as a system, we actually would reduce the need for a PRC quite dramatically. So just sit and think about that for a minute, right? While yes, it's really good that we know how to treat people, if we had a really effective system that was equitable, that was accessible, that allowed for people to walk into the hospital or have a medical home, or to be able to earn enough and save enough money to be able to buy their own home and had stable community, had stable supports in their own communities, would we need as many PRCs? Not likely. We would still see some needs. Some people will fall through the cracks, but I think the caseload, the number of people who are in desperate need, the lines going down the street at the homeless shelters, and all the many disparities and terrible data that we hear and learn about every day in our public health reports, in our economic reports, about just how poor the conditions are for so many people, 100 million people actually, in the United States, a third of the population that is living or in or near poverty in the United States. That's just a tremendous figure to really think about. We are now talking about a third of the population living in or near poverty, meaning 200% of poverty or below. So we are no longer talking about a marginal group of folks. And what we know also about poverty is that once you're living in poverty, all these other things start affecting you in a different way too. Your health is impacted, which leads you to a PRC. Your housing situation is impacted, which leads you to a PRC. Your financial stability is impacted, which leads you to a PRC, because we service all of these problems through programs which are needed. But again, if we had a more effective workforce development program and system in this country, if we had a more streamlined housing support system in this country, if we had a better accessible healthcare system in this country, we probably would reduce the need for someone like a PRC. And so what this group that Brett and Kelly had started long before my time coming to PRC, this Black Leadership Council group, was meeting every Friday prior to the pandemic to just talk about these things and to try to figure out, these problems are so big, they're so intractable, where do we start? And then the pandemic hit. And the conversations got even more intractable. The agenda grew even larger, because these inequities and these disparities got even bigger to think about how do we even approach some of these problems. And I think the answer has led us, after a year and a half of discussion. Every Friday, this group meets. And every Friday, this group comes to the table. And before we open up business, people are checking in about how they're feeling, how they're impacted, how their work is going, how their clients are faring during this time. Many of us are service providers for folks in community who are struggling on the margins. And after a year and a half, we finally landed, I think, a really solid agenda that we wanted to share with you tonight, that really articulates this upstream set of systems that we know need to be reformed. And I was very fortunate to be able to come to the organization with a series of partners, of folks around this country who have also been thinking about these problems and have done a lot of the research in the policy development and the ideation around how to start tinkering with that systemic level set of reforms that are needed in our housing system, in our workforce development system, in our banking and financial system, in our healthcare system, and our education system. Those are just a few. We know there are other problems. There's police reform. There's a host of, there's tax issues. There's so many things that lead to this desperation that we're seeing with 100 million people living in poverty in this country. But we knew we couldn't do everything. And so this group every Friday has been saying, well, where do we start? And even if you pick one of these things, you still got, I mean, you know, it's not like the healthcare is the easy stuff, or it's not just like the housing stuff is the easy stuff. But what we did say is that if we were able to figure out a way to try to harness some of these movements, because each of those issues areas have a movement, not just nationally, but here in California, of advocates and think tanks and community organizers and service providers who are all clamoring at different pieces of the political kind of puzzle around when's the right moment to go after this program, or when's the right moment to try to tackle this issue and to get more funding for that program to be able to treat more people, just like a PRC. And we actually think that while that's a valuable set of work, we actually are trying to do something slightly different, which is really trying to change some of these systems. So I'll share with you a quick synopsis, a quick preview of some of what we're thinking about. I'll share my screen here. To talk a little bit about the Black Leadership Council's policy agenda. When we were developing the website, we realized that we needed to get a little less wonky about this agenda and to talk about not just where, you know, which policies we want to engage in, but why we're here. And so I'll just kind of read this out loud. We are here to change systems, broken systems. We seek partners, allies, and champions who are willing to help reimagine a new ecosystem for Black Californians across wealth, health, housing, and education. Our mission is to advance meaningful change across these systems of care that have historically harmed Black health, wealth, and prosperity, and that we seek to do this by bringing change through the legislative and partnership strategy process. I think it's important for us to name these parts, these individual parts of our mission, because there's a lot of different ways that we could approach this, but we specifically chose to focus on legislative and cross-sector partnerships and coalition partnerships. These are our 4 pillars around wealth, health, housing, and education. I won't go into too much depth here, but overall, just understand that we are trying to build on the community of advocates and thinkers around the country who have been grappling with these issues for a very long time, that this is not new or nascent set of ideas that we're trying to create from scratch, but that we want to build and consolidate many of the ongoing efforts that have been around for decades around better home ownership and access to financial services and banking services that can support people saving for the future, climbing out of debt, being able to open small businesses, to have reasonable terms for loan products that right now are sinking people into deeper levels of poverty. We want to be able to tackle the healthcare crisis, not just from a healthcare standpoint, from a health standpoint, but also from a financial standpoint, because despite the Affordable Care Act legislation from 10, 11 years ago, healthcare bills and debt is actually still the #1 cause of bankruptcy in America, sadly. We want to talk about the housing system in a slightly different way to figure out how do we impose different types of regulations and expectations of our banking community and our banking partners here in the state, who understand and acknowledge the role that banking had in redlining and the impacts that we're still suffering here today as a result of that redlining. And so we have some ideas around, in order to operate in the state, what banks should be doing to reverse its impacts of redlining and segregation and poverty that those practices created. And then around education, we're not going to go super deep into specific education reforms or things that need to happen in schools in terms of testing criteria, et cetera. But what we are thinking more about is how to create more education and racial equity within communities of color, particularly those school systems who suffer with low funding supports for social and economic and racial inclusion efforts for our kids. This is a brief preview of our website that we'll be launching next week. And so you all have a quick sneak preview of some of the things that we have not released to the public yet, but you'll be receiving more information about what that looks like once we launch next week. We're really excited for this public launch, and I'm going to stop there. I think I've kind of slightly gone over my time, but really I'm looking forward to folks' questions and as we offer ideas on ways to support this work. Thank you.
Great. Thank you, Chris. And thank you, all of our panelists. We'd like to open things up for questions at this point. We've got about 20 minutes left to this session. And please feel free to raise your hand using the hand feature on your screen. And you're also welcome to add questions to the chat function if you're more comfortable doing that. So please feel free to do that. I know we have an initial question here, and that is to the panelists, if you had to give some suggestions to the group about what they could do individually to affect the Black prosperity agenda that you've begun to talk about tonight, what are some suggestions that you might have of how people can become more engaged in the efforts that the Leadership Council and PRC's initiative are carrying forward?
Well, first, I think about ways in which you can traditionally support us, which of course is to donate to PRC and our effort. But I often want folks, and I charge myself with homework all the time. And so that's what I would invite folks to do, is to charge yourself with a little bit of homework, particularly as we celebrate Black History Month. I often talk about how to make it more than a month, but also make it easy and digestible for you in order to do that. And one of the ways that I just firmly believe we could have a better understanding of the African-American experience is to go out of your way to just educate yourself. I encourage you to read some very good history books that are out there now that speak to the story that wasn't fully told in all of the best history classes that we had. And I know I'm looking at a lot of people on 2 pages who went to really good, accredited, reputable schools. And even in the best of their efforts, the African-American story is not fully told. And when you hear that, when you understand that, when you get a better understanding of that, you will appreciate the nuances and the differences, and in many ways will help you attribute greater value to the population and its contributions to the United States, and why you would want to see the growth and the development and the success of that population. Because when you help that population, the African-American population, to succeed, America succeeds. And we have way too many examples of that. So that's what I would offer.
Thank you.
Start small and start with a book.
Thank you. We've got a lot of questions coming in at this point, so I'm gonna keep things going as quickly as I can to try to get to as many people as possible. One of our questions was around geography. What's the geographic scope of the work of the Black Leadership Council, and what other partner organizations are involved with the council? If Chris, maybe you could take that one if you don't mind.
Sure, that was one of the corners I cut. I should have mentioned that, sorry.
That's okay.
Here that talked about our co-chairs, but in short, we have close to 40 organizations, primarily in the Bay Area, whose leaders have been involved in various phases of this work in the set of conversations. Our co-chairs are Kelly Dearman, who you heard from earlier, Brett Andrews, Tamika Moss, who is the founder and CEO of All Home, which is a statewide housing advocacy organization. Those are our leadership, but again, we have several dozen members who have been contributing to this effort. We'll be sharing more with the larger group. We have a kind of a core group of 15 to 20 folks. Jimmy Loyce is a part of that core group of folks who have been helping us to refine and hone this agenda. And where we started was thinking locally. But the more we started getting into the systems conversation, that I was describing earlier, the more we realize we need to go big. And so the geography focus for this would be statewide California legislation that we have already begun speaking with policymakers about, who I think are interested in helping us create legislation to be introduced probably late this year, early next year.
Kent has a question, Kelly. He wants to know what high school you did attend.
I went to Lowell, and I understand, there's a little problem there now, but I did go to Lowell.
Yeah, it's in the headlines every day lately.
Every day.
We have another question. How are you prioritizing where to start? Are you forming groups to tackle them all from the get-go? Is there an initial focus?
Can I go?
Yeah, let's let Kelly, if you don't mind answering, that would be great.
So I'll just start, and Chris, you jump in. So in my view, it's the Black prosperity agenda that encompasses housing, education, health, and wealth. And so we have split up into groups, and we're each tackling those, we're getting more specific in those areas. But, really what we are saying is, this is the agenda, this is what we want to push forward. And we have under each pillar, we have these ideas and goals for how we can get there.
Great.
Chris, do you want to add on to that, or did I?
Sure, yeah, and I think it kind of gets at Laura Powell's question around the legislation. What will it do? And so I gave a quick preview earlier, just kind of the buckets, but essentially we're talking about a broad suite of policy proposals that would be comprised in one piece of legislation. Now, this piece of legislation will probably end up getting referred to several committees across the legislature because they cover such disparate areas. And so over time, we imagine this will probably get broken up into pieces, which is completely fine. We see this legislation being seen as a package and a banner that people can start to rally around. And then over time, yes, pieces of this around housing and financial services reform can go into some of the things I talked about around new regulation for banks, for instance, and loan terms, education reforms around how to create better inclusion for students of color who are struggling in schools, healthcare provisions that could get at creating healthcare homes for people, not just simply giving access to Medi-Cal, for instance, right? So those are a couple of the ideas that are percolating on. We haven't released kind of the full details of this yet because we thought it was important to kind of land on a set of principles first. While there are more details kind of, in the works, we know that this is going to be a process. And that's why we're not rushing right out to introduce something sweeping right now without gaining more partners, more allies who at least are in line with this vision of sweeping reform across several systems at the same time.
For whoever would like to answer, maybe Brad, can you talk a little bit? Part of one person's question was around kind of main additional organizations that are affiliated with the Leadership Council. Who are some of the main, maybe you could share a little bit about who some of the main partner organizations are at this point.
Yeah, I will talk. I'll say that certainly, here's what I believe. We know that African Americans are disproportionately service dependent, meaning they access services more than any other population in the United States. And so what we thought to do, or at least in the health and direct service component, is to band together those service providers who are providing a set of services, both in Northern California and in Southern California. It's important for you to know that we're coalition building. We're in the process of coalition building right now, and have reached out to them to get the LGBT Center and to make sure that we talk to the Desert Aids Project and HRC and all of these organizations who are coming together to address the issues from the service perspective, because to Chris's point, we've got to find a way of African Americans accessing less programs and services. And the only way you're going to be able to do that is to build a system of prevention and support so that they aren't disproportionately represented there. So at least in the Bay Area, we are direct service heavy, and we've got the key providers that are there: Westside Community Services, San Francisco AIDS Foundation, PRC, Kelly Dearman, and of course, in-home supportive services. So many others that are there that make up already a rich mosaic of our service providers. But for me, it is my passion and priority to find a way of stabilizing an individual so that they never have to fall into a level of disenfranchisement, marginalization, and disrepair, so that all we're ever doing is building a system to take care of disadvantaged brown people, but more building a system that allows them to engage in the fullness and the franchise of the United States, equal to everyone else in the general population.
Great, thank you, Brad. Chris, a question for you from Polly. Polly, thanks for joining us tonight. She asked about whether there are state legislators or other elected officials already on board with the full vision. I know you've been doing a lot of great work on that front. Could you share a little bit about that?
Yeah, we've had several members of the legislature join us over the course of the past year. Scott Wiener, David Chu, huge supporters and thought partners with us on this about ideas. We thought it was a good place to start, given that there are representatives from many of the members of the council in terms of the footprint of our current work, in terms of organizations in San Francisco. We've also had invited and had a really great in-depth conversation with Nancy Skinner, who is now the chair of the Budget Committee. We've also had, other policymakers on the local level, Shaman Walton, another statewide leader, Malia Cohen, who's the chair of the Board of Equalization, others who I think are all kind of feeding, and this is frankly part of how we even landed here, right? So some of their feedback and some of their ideas are actually baked into some of this that we're developing now. So we have an agenda moving forward over the next several months to continue building out that target list of other potential allies and partners in the legislature, and frankly, probably even more importantly, I think, around the state. Because as I mentioned, each of these issues has such a movement and a base that the majority of the work, while it's not going to be easy to move anything through a legislature, that's almost cake compared to the massive statewide effort of coalition building. We cannot underestimate the massive number of resources that it really requires to gain partners in some of this.
Can I just jump in and say that we're also we were trying to get to Dr. Weber before she got snatched to be the Secretary of State, who initiated, frankly, the statewide reparations task force. And we're still going to invite her in for her thoughts. I do want to just say this is important because there are many other movements that get traction and wind and have taken off. And I also am a gay man, so I'm very close to the LGBT movement. There hasn't been a proliferation of this work. And that is why it's important for us to get it right. And as much as I have to even check myself with my exuberance, and you can feel my energy certainly tonight, and I pretty much have that every day, it is important for us to stay here because it took us quite a while to get here, and it's going to take quite a while in order to contemplate all of the many moving parts that get us to the next level. So I just want to share that with you. And for anybody who is close to PRC, and I see some board members, they know that our motto is to work really hard internally and have one message and one message only and come out once. And so we don't have to keep changing it. So I'm looking forward to just staying in this work in these early stages. It's difficult, it's challenging and sometimes frustrating, but it's the work that needs to be done. And I think this is our moment in time to do that.
Mhm.
There was another question here about whether or not the Black Leadership Council has its own separate 501c3 status. Maybe we can answer that and also talk a little bit, whoever would like to do that, maybe Kelly, about sort of longer range vision for the council and whether you've kind of talked about a strategy a few years out of where you'd like to be taking this work.
So first, I think one of the big things that we're doing is building community, and I think for those of us who are on the call every Friday, that's what's really become clear, that we are building community. And to do that, we have to develop trust and really get to know each other. I think the long range plan is to really get this legislation moving and show that if, if this is what we're doing in San Francisco and we can really take it, it can be a much broader coalition, and hopefully we'll get partners all over the state. We're working on the Bay Area now, but the goal is to get partners all over the state. Because it is time, as Brett said, for us to start recognizing it's a good time now to really speak about Black prosperity, who we are, what we expect, and where we are trying to go. So the long-term plan is to keep pushing this forward, because we all imagine our first run at it, we probably won't get everything that we want, right? So this will be an ongoing process, and to build, to have more allies and more partners join us.
Thank you, Kelly.
I just wanted to follow up quickly on the specific of that question. The Black Leadership Council is an initiative and a program of PRC at this moment. And Kelly knows this and Jimmy knows this, who were there early on. We had a specific conversation that said, this is the community's vision. And if the community wants it, they have to invest in it. So this isn't about just PRC. We need to make sure that the issue is always front and center. And however it forms itself organically over time, it will allow itself to do that. And if there's an opportunity for it to spin off and become a 501c3 and it makes sense, we'll definitely do that. But right now it sits as an initiative and a program of PRC.
I think it might, if it's okay, Kathy, maybe Jimmy has something to add about long-term vision.
Yeah. Jimmy, there you go.
I think what you all said speaks very eloquently to where we're headed. I think that one of the things we need to recognize is once you get legislation passed and signed by the governor, the job is not done. Then it comes to implementation, then it comes to refunding and then refunding whatever initiatives that we want to utilize going forward for the community.
I think it's important to also share a little bit about why we chose this structure. While it is a project of PRC, that is essentially we're serving as a fiscal agent, but how leaders of this council and why we named it the Black Leadership Council is because members themselves are here as individual leaders. Yes, they have day jobs and we use their titles and organizations as identifiers, but we are not asking folks for their organizations necessarily to be signed on to any piece of legislation, because we wanted to remain and to collect the voices, the individual voices who happen to be Black in this region. One, because when we looked around, we actually didn't see any council doing that. We actually didn't see any voices of collective groups saying, we're not speaking just from a deficit mindset about the traditional narrative that when we think about how to assist efforts that can elevate prosperity for the Black community, we usually are speaking from a very different kind of a set of assumptions around who that voice is. And I think there is huge momentum and a lot of movement happening with grassroots voices, and that is probably even more important role to play. Where we saw the void are leaders who happen to be Black, of organizations, of government entities in this region, speaking together with a voice that may actually be slightly different than, say, their national organization or their, the organization that they work for. And that's the risk that we're actually asking leaders to take by being a member here. And we haven't received any pushback to date. So that I think that in and of itself is just a unique point to raise.
Thanks, Chris. We have one more minute and then I want to have a minute to close. A really important question from Brian Schneider here. What is the best way for people to engage with a Black Leadership Council? So if you had to make a couple of quick suggestions about how folks can engage post-event, Brett, maybe you might want to.
Well, I'm gonna start focused and small, and we're going to be proactive. So I'm hoping that we have the emails of everyone who's on this call. I'm looking to my development team in
We
order
do.
to agree on that, because in a week's time, we are going to go live with our website. And part of that not part of, the great charge of that website is to communicate with the world who we are, that we are here and for the long haul. And when you get that invitation to join, we encourage you to donate to the cause. We really would love for you to donate. I mean, I'll just be I wouldn't be an executive director worth my salt if I didn't somehow make a pitch for folks to join in and contribute certainly their treasure. And as we design and build ourselves, we will be looking for you for your time and your commitment as we move forward and as we build our allies. And we make the commitment to push out good information and important developments along the way that not only talk about the work that we're doing as a council, but to educate everyone around what is going on for African Americans across California. So I think it is a useful and informative tool. That's how we see it. That's how we hope that you will see it when you get it. And we hope that you will be receptive when you do receive the invitation.
Thank you, Brett. Well, it's time to close. We're at 6:30. I want to thank everyone for joining us tonight. It's really been a wonderful, robust conversation, one of many that will continue on with PRC and the African American Black Leadership Council. Again, if you had other questions and they weren't able to be answered tonight, or you think of others, please shoot us an email. We look forward to staying in touch. As Brett said, the launch of the website will be happening very shortly. So we will keep you in the loop through our PRC e-newsletter and through the special website that's being formed. Thank you all, friends, donors, board members, advisory council members, staff, for joining in this conversation tonight. It's really been wonderful. Have a lovely evening, and thanks for tuning in. Take care.
Wonderful evening. Thank you.